pregnant women, do they need more treatment after they give birth?
Yes. So not only are their hormonal levels off, but they have less time to take care of themselves.
Yes.
I remember my wife not being able to take a shower all day,
Yeah.
let alone floss and brush and
Yes.
put on their makeup and everything else, just because baby's crying or sick or
Yeah.
colic or who knows what.
Yeah. Yeah.
So it becomes, I try to see them more frequently and encourage them to get their dental health back up to where they should be.
Yeah. That happened with me. I lost one of my front teeth during my pregnancy, and I'm a dentist, and I was getting constant, frequent cleanings by my brothers, and Dr. Z Simon took care of my gums, but it's hard. It's hard when you have a child and they're crying and you're trying to breastfeed them and you're trying to take care of yourself and feed yourself so you can breastfeed, and it's a lot going on all at once. And I got really depressed after I gave birth, and I felt like I wanted to help other women know, first of all, it's okay to feel a little helpless, but you need to seek the right help.
Right.
And part of that help for your mental health as well as your dental health and your physical health. Because your dental health, once you start having cavities and going to the dentist and spending all this time and money, it's not a lot of fun, because nothing is like what you were born with, right?
Absolutely. Absolutely.
So I was in a rut, and I got myself out of that rut, and this is part of my mission. And we were just talking before we went on set how you recently made a switch and you started exercising again, and you're looking great and you're feeling great, your energy is amazing. Can you just tell us about that transformation? Because the more people talk about that, I feel the more people that you will touch, because people are going through crap every day, all day. And it's all how you deal with it. So how did you deal?
Well, I recently had a hip surgery, and the last few years it had been affecting me, and I kind of slowed down and I got lethargic and I didn't want to do things and didn't want to get up and whatever. I'm laying there in bed and I'm in pain afterwards and everything, and I told myself I don't want to live the rest of my life this way. And we always tell ourselves, I'm going to, exercise and do things just like we do the New Year, New Year's promises that we tell ourselves.
Resolutions.
Yeah, resolutions. And I just decided I have the rest of my life to be happy and feel good. And I started, I joined a gym, and I started out just seeing if I could pick something off the floor, and took a stiff man yoga class, and I was already there, so I thought I'd do a little cardio.
Perfect.
And it, made me feel better. And I started looking into other ways to feel better and be more positive. And it's contagious.
Amazing. No,
it's
your
contagious.
energy is great.
Yeah,
it's self-love. It's all about self-love.
That's what it is.
One thing that we forgot to touch on, and I want to touch upon, is senior citizens, and how as people age also they become more prone to dry mouth, not just from the medications but from age.
Absolutely.
And that's another component to wanting to tell your patients that are a little older with drier mouth to take these xylitol products.
It's really sad. You see these patients, and maybe not that far from me, a generation away, but they're 70s, 80s, and they've been taking care of their mouth, and they're so frustrated that we're chasing decay everywhere. And some of them are physicians, and in my practice, they're physicians and they're intelligent people, and they've been eating right.
So what do you tell them?
And one of the things I tell them is look for xylitol products and be aware of foods that might affect their pH, and they got a soda stream, and some they think they're drinking carbonated water, but it actually produces acids in their mouth. The acid affects their teeth. Yeah.
Absolutely.
Yeah.
Well, thank you so much for your expertise and your time. I really appreciate it.
Absolutely, my pleasure.
Absolutely, and I hope you all enjoyed this. This man has 36 years of experience and counting. He's talented, he's kind, and he's a very soulful dentist, and I'm proud to have him in my field and as a mentor. He speaks from years of practice, not just from studying in the books or going to dental school. So I really appreciate his guidance, and I hope you guys did too. And let us know if you have any questions, and we'll see you in the next video.